Okay, so today we're going to talk about something that's often just brushed off as admin work, but it's actually a huge piece of modern healthcare strategy. I'm talking about clinical documentation. We're going to connect the dots between what goes into a patient's chart and some of the biggest global health goals and corporate responsibilities out there. So let's pull back the curtain and see exactly how that happens.
So let me just start with this question because it really sets the stage for everything we're about to cover. What if that routine task, filling out a medical record, the thing that often feels like tedious paperwork, what if that was actually the single most critical control point in the entire healthcare system? It's a pretty bold idea, I know, but stick with me because it completely changes how we should be thinking about this process.
And this slide just nails it. This is the core argument right here. On one side, you have the old school view, documentation is just this annoying administrative chore. But on the other side, you've got the reality of what it is today, a powerful strategic way to control risk. Think about it. Every single entry, every code is a data point. And that data point informs patient safety, it informs the quality of the institution, and ultimately it backs up the integrity of the whole organization. It's not just about keeping records, it's about governance.
All right, so to really get why this is so strategic, we need to zoom out a bit. Let's look at the global health connection. And you'll see how this process, which feels so internal, actually links up directly with some massive international commitments. And that brings us to this big thing called SDG 3. So this is one of the UN's Sustainable Development Goals, which is basically a global promise to ensure healthy lives and promote well-being for literally everyone everywhere. It's a huge, ambitious goal, and it guides health policy and investment all over the world. But you have to ask, how does a giant global goal like this actually become a reality on the ground?
Well, here's where it gets really interesting. SDG 3 isn't just some vague wish. It specifically demands things like quality care, patient safety, and, this is the important part, measurable outcomes. And here's the kicker. None of that can be proven or tracked or improved without a clear, accurate record. Clinical documentation becomes the linchpin. It's the actual hard evidence that turns this global ambition into a real, tangible responsibility for an institution.
Okay, but this is where we hit a huge snag. If all this is built on a foundation of documentation, we have to ask, where are the cracks in that foundation? So let's dive into where this system so often breaks down. And this right here, this shows you the broken chain of command, so to speak. It all starts with something that seems small, right? Like inconsistent coding or a simple manual data entry mistake. But then that mistake gets magnified by non-standardized clinical language, where different doctors describe the same thing in slightly different ways. That mess creates really weak audit trails, making it almost impossible to accurately trace what's happening. And the final, critical break in the chain, a total disconnect between all these clinical records and the high-level ESG reporting, that's environmental, social, and governance, that boards and investors are now demanding for accountability. All right, so we've laid out the problem. How do we actually fix it? Let's start building the solution. We need a framework for integrity, a clear governance model that's designed specifically to rebuild that broken chain.
And here it is. It's a simple but really powerful governance pyramid. See how everything rests on that foundation at the bottom? That's documentation accuracy. That means using standard codes, standard terms. Once that base is solid, you can build the next layer, reliable quality and safety metrics, like tracking medication errors or infection rates. And only when you have that solid middle layer can you actually get to the top, true ESG accountability, where you can transparently and confidently report on your health outcomes and your social impact. Now, this is a really, really critical idea. You should think of document coding as the essential translator. It takes all the complicated, messy, real-world events of clinical care, and it translates them into the structured data that's needed for that high-level ESG reporting. If that translation is wrong, the whole message gets lost. The data becomes totally meaningless.
Let's make this super concrete with an example. Take a look at the safety domain here. The clinical indicator, which is pulled right from the documentation, is the medication error rate. Now, when that data is collected properly and added up, it becomes an incredibly powerful ESG metric for social impact. It tells a clear story to stakeholders about how well your institution is protecting its patients. That is the connection. And you can see the same logic applies all the way down, for quality and for compliance.
So how do you actually make this happen? Well, here's a clear four-step action plan. First, you have to standardize your coding systems across the entire organization, no exceptions. Second, you build in digital traceability with really robust electronic health records. Third, you develop a risk-based documentation policy. This helps focus everyone's attention on the most critical data points. And finally, you guarantee integrity with independent reviews, bringing your clinical and ESG audits together. Okay, now for the most important part, the payoff. What actually happens when an organization gets this right? Let's look at the real-world impacts you get from strong documentation governance. The benefits are just huge. I mean, first and foremost, patient safety gets better because you're learning from accurate data, not just guesswork. Your risk of litigation plummets because your records are crystal clear and defensible. All of a sudden, the credibility of all your data for research, for funding, for planning, it just skyrockets. Your ESG reports are no longer just feel-good stories. They have real scientific integrity. And all of this leads to the most valuable asset any organization can have: genuine, earned trust. And I want to end with this quote because it really just sums it all up perfectly. If documentation fails, quality collapses. If quality collapses, ESG loses credibility. It's a chain reaction, and it all starts with one patient record. So that leaves us with one final question to think about. In your organization, is documentation just a task, or is it the foundation of your entire strategy? Thanks so much for joining me.